Well, Tunisia is experiencing its most intense COVID-19 crisis since the start of the pandemic. Over the last week, we saw an average of 166 deaths per day and 7,500 new cases per day. It's worth remembering that Tunisia actually widely seen as having successfully managed the first outbreak of COVID in March 2020. It locked down its population early and it managed to avoid the chaotic scenes that we're now seeing in hospitals here in the capital. We spoke to a young doctor from an emergency department at one of the hospitals here in Tunis, and she said that they were totally overwhelmed. She works in a room which has got 15 beds in it. There are 40 beds now crammed into that room, and she's having to make very difficult choices, having to choose between which patients she can treat, depending on how young they are and their chances of survival, because she's running out of oxygen. There aren't enough staff members, there aren't enough beds, and the hospital is completely overwhelmed. Now, the vaccination drive is beginning to take shape. It's beginning to accelerate. We're outside this vaccination centre in the capital. You might be able to see behind me lots of people in line waiting to get their jab. Still very much focused on the elderly here in Tunisia. We can take you inside now to meet one of the doctors who's running at the centre, as well as some of the people who are getting their jabs today. The government has put in some place lockdown measures, so Tunisians are not supposed to travel within the country, and there is a nightly curfew in place. A measure which is trying to get in place, and it announced yesterday, is that it wants private clinics to share the burden when it comes to the COVID-19 crisis. It's demanding that they take on patients and they play their part. Now, that's easier said than done, as obviously private clinics are used to charging their patients often substantial sums of money for treatment. So who's going to pay for that? In addition, some private clinics are not necessarily equipped to put in place a COVID-19 service. They don't have the personnel, or they might not have the material in place. So it'll be interesting to see over the next few days how that measure will develop. So social distancing measures could be put at risk as families get together to celebrate. Seem to have successfully managed the first wave of COVID-19 back in March 2020 because it locked down its population quickly. Now, though, we're looking at over 7,000 new cases a day, and on average last week, 177 deaths per day. It's never been as bad as that since the pandemic began. We actually visited a public hospital here in the capital, Tunis, and it was a chaotic scene inside. We spoke to doctors who said that they were completely overwhelmed. We went into a room which has 15 beds in it, usually in the emergency department, but there were 40 beds crammed into it with mostly elderly people in there fighting for their lives. We spoke to one doctor who had just finished a 24-hour shift, and she was absolutely exhausted, and she told us that she had to make very difficult decisions about who to treat because she's running out of oxygen. Now, some good news is that oxygen has now arrived as a donation from France, Italy and Algeria, and so in the next few days that will be distributed as fast as possible to hospitals around the country. So hopefully that will take some stress off the situation at the moment. With COVID-19 cases at their highest rate since the start of the pandemic, Tunisia is racing against the clock to vaccinate its population. As you saw there in our report, the next challenge will be vaccinating younger generations. First of all, making the vaccination available to them, because with the exception of health workers, vaccinations here against COVID-19 are only available to those over 50. So that's the first task. And after that, actually convincing younger people to get a jab is going to be a challenge. Some, as you saw in that report, are reluctant to do so. They're not quite aware yet of the importance of having a population which is fully vaccinated against the virus. You heard the doctor in that report. He says that the only way for Tunisia to combat COVID-19 is to improve the vaccination rate across the country.